Hi, I'm a neurologist who has to visit a lot of patients with cognitive impairment every day in my practice. I usually use mean mental status exam or MMSE as a part of neurologic examination of patients with cognitive impairment or dementia. MMSE is a 30-point questionnaire that is used extensively in clinical research setting to measure cognitive impairment. It also used to estimate the severity and progression of cognitive impairment and to follow the course of cognitive change in any individual over the time. So it's an effective way to document an individual response to treatment. In this presentation, I'm going to speak about what MMSE is, what is not. The crucial point you have to do and pitfall you have to be aware of when applying MMSE on your patients. First of all, remember that MMSE is copyrighted. Yes, it is. Also known as Feldstein test, was published in Journal of Psychiatry Research in 1975, while the MMSE was attached as an appendix to an article. Dr. Feldstein clearly stated in their seminal paper that MMSE cannot replace a complete clinical appraisal in reaching a final diagnosis. MMSE, also known as Feldstein test, was published in the Journal of Psychiatry Research in 1975, while the MMSE was attached as appendix to an article. Dr. Feldstein clearly states in their seminal paper that MMSE cannot replace a complete clinical appraisal in reaching a final diagnosis in any individual patients. But as frequently happens, this major caveat was quickly forgotten, and over the course of next 40 years, MMSE gained immense fame among clinicians as quick and easy method to diagnose dementia. MMSE is a reliable tool for screening of patients suspected of having dementia, but MMSE has a few advantages and disadvantages. Advantages are it's requiring no specialized equipment or training for administration, has both validity and reliability for diagnosis and longitudinal assessment of Alzheimer's disease. Its short administration period and ease of use. It's useful for cognitive assessment in clinician office space or at the bedside. But its disadvantages are it's severely affected by demographic factors, age and education. Should not be used clinically unless the person has at least a grade of 8 education. Its lack of sensitivity to mild cognitive impairment and its failure to adequately discriminate patients with mild Alzheimer's disease from healthy subjects. Now I'm going to show you essential practical point you have to remember. MMSE settings. Before the questionnaire is administered, try to get the person to sit down facing you. Assess the patient's ability to hear and understand a simple conversation. For example, what's your name? If the person uses hearing or visual aid, provide them beforehand. Introduce yourself and try to get the person confidence. Before you begin, get the person permission to ask questions. For example, would it be alright to ask you some questions about your memory? This helps to avoid catastrophic reactions. The following equipment is required to administer the instrument: watch, pencil, page with close your eye written in large letters, page with two 5-side figures intersecting to make a 4-side figure, a blank. Try to minimize the patient's stress and be sensitive when the patient shows embarrassments about their inability to answer these questions. Introductory script could be, I'm going to start by asking questions that require concentration and memory. Some questions are more difficult than others, and some will be asked more than one time. Before starting MMSE, a few more points to remember. Question cannot be answered by a proxy. Ask others to do not interfere during your examination. Do not indicate or correct patient's errors. If the patient asks, "What did you say?" do not explain or engage in conversation. Merely repeat the same directions as a maximum of 3 times. If the patient interrupts, for example, "What's this for?" reply, "I will explain in a few minutes, when we are finished. Know if we could please proceed. We are almost finished." Refusal considered as an error after minimum encouragements. The patient with non-cognitive disability, such as the patient who is illiterate, blind, or has arthritis, the score should be corrected the number of possible answers. I will explain it in the end of this slide. Please write the ambiguous response of the patient on the margin of the form. You can download a bunch of forms and instructions online, but remember, MMSE is subject to copyright law, especially if you are going to use it in a research. Here's one which I downloaded from Oxford Medical Education. MMSE forms had many sections, which I'm going to explain. Please consider you have to follow the standard order. This structure is built on scientific basis and should not be changed. Here, write the patient information. Then this section assesses orientation, registration, attention and calculation, recall, language, and finally copying. So let's see how each item is assessed. Orientation. It's essential that start from broader question to narrow, from year to date, and from country to floor. Ask, what's the date, year, month, and date. Then, what's the season, day of the week. If the patient does not mention a specific item, ask, can you also tell me what the month, the year it is? Since the distinction between seasons can be difficult during certain months, one big leeway is allowed on either side of the actual date. Please score only correct answers. In orientation to place, the point is that the name of the country where the person lives should be asked rather than the country of the testing site. And the name of the street where the individual lives should be asked rather than the name of the floor where the testing is taking place. This is very important. For registration, you can ask the patient, "May I test your memory?" Then go ahead with this script. I'm going to name 3 objects. After I've said them, I want you to repeat them back to me. Remember what they are, because I will ask you to name them again in a few minutes. Apple, table, penny. Then ask, can you repeat 3 items for me? You have to use only the word list from the standard available list. Do not make them up. Remember, you have to allow approximately 1 second for each items. If the participant asks you to repeat 3 items, respond, Can you tell me the item I've just mentioned? Or say, just do the best you can. Remember, the correct order of repeated item is not essential. Do not repeat item on the first trial. When asked to repeat 3 items, apple, table, penny, they might repeat April, table, pencil. These alternate responses should not be accepted both under repetition and recall condition. You should remember, maximum trial of 3 objects is 6 times. If there are 6 after 6 trial, he or she does not eventually learn, no score to recall to. Attentional calculation is assessed through serial sevens and backward spelling of the word. First, make sure the participant is attentive. Please remember that serial sevens and word should not be considered equivalent items. Both items should be administered and higher of 2 should be used. These items assess attention, concentration, calculation, and also prevent individual to rehearsing the 3 objects. It has been suggested that serial sevens might be more appropriate in population where the English is not the first language. For serial sevens, ask the patient to begin with 100 and count backward at 7. Stop after 5 subtraction: 93, 86, 79, 72, and 65. For scoring serial 7, each number must be independently compared to the prior number to ensure that a single mistake is not unduly penalized. You can see in the left box. For backward spelling, word should be spelled forward and corrected prior to spelling it backward. A script for backward spelling is, no, I'm going to spell a word forward, and I want you to spell it backward. The word is word. W-O-R-L-D. Please spell it in reverse order. Let me show you how to score backward spellings. You have to score 1 point for the number of correct position or order of the word. This is the right one, and the score is 5. But in this situation, only 3 words are in their correct position, so the score would be 3. These are other examples. As you can see, the correct order of the word get 1 point. In backward spelling, you have to write both score and exact word of the patient on the form. So, after assessing attention, you have to do recall assessment. Because mental task in previous section, the patient does not repeat the 3 words and use another memory mechanism in recall. Ask your patient, what's the 3 objects I asked you to remember a few moments ago? It's alright if the patient repeats the word in any orders. If your patient does not remember the word, use multiple choices. Do not score, but remember that in subcortical dementia such as vascular dementia, patient might remember the word by giving them on the cue. This is not happening in Alzheimer. I recommend writing this item on the form too. So, for language, you have to assess the following item in language: naming, repetition, comprehension, and reading. Please do it in the precisely these orders. For naming, the script could be, "What's this called?" First show your watch and then a pencil. Correct response include watch, wristwatch, timepiece, and then show the pencil to the participants. Note, the pencil should be a standard sharpened wooden pencil with a razor. For repetition, ask your patient, please repeat the following. No ifs, ands, and buts. Some judgment must be made on the part of examiners as to whether the repetition could hear the S or not. Scoring must be exact. For comprehension, MMSE use a three-stage command test. Ask your patient if he or she is right or left-handed. Take a piece of paper, hold it up in front of the person and ask, take this paper in your right or left hand, whichever is non-dominant, fold the paper in half once and both hands and put the paper down on the floor. Score 1 point for each instruction executed correctly. So you have to say to patient this script. Take this piece of paper in your right or left hand, fold it in half with both hands and put it in your lap or on the floor. If participant is unable to use right hand because of physical disability, you can alter instruction to read, take this paper in your left hand, fold it in half with your left hand and put it in your lap. The goal is to see whether the subject is able to follow 3 steps commands. So this variation to the direction to accommodate the subject's physical limitation is allowed. Read the full statement before handing the paper to the subjects. Please remember, do not direct the paper to the participant's right side. Hold the paper in front and have the participant reach out to take it. Observe which hand is used. Give the paper to right hand. It's important for assessing agnosia, I think. Remember that you have to reading out loud and do not repeat instruction or coach participants. Only repeat if the examiners felt it was not heard or instructions were not given clearly. Just repeat the direction in full as they were the first time. For scoring 1 point for each correctly performed. For reading, on a blank piece of paper, print this sentence, close your eye, in large letter as the patient can say it clearly. The script could be, please read the following and do what it says. Score 1, let the patient just close his or her eyes. No score if the patient just read it out loud. For writing, give the patient a blank paper or back of your form and ask her or him to write any complete sentence on this paper for me. Please do not dictate. Sentence must contain a subject and a verb and has a meaning. Repeat the instruction to participant if necessary. Write in comments such as sit down, where the subject's limit implied are considered correct response. Spelling and/or punctuation errors are not content error. If participant is cognitively able to dictate a sentence but is physically unable to write it, in this case, examiner should write the dictated sentence and make a note that it was dictated. For copying, you can say, here is a drawing. Please copy the drawing on the same piece of paper. Please remember that all 10 angles and the overlap figures must have 4 sides. If participant asks if the figure should be drawn separately or together, the examiner should respond, draw the figure as you can see them. Let's talk about how to score MMSE. As I mentioned before, individuals with a peripheral impairment such as blindness or restriction of the hands due to arthritis or other peripheral disorder are scored the number corrected out of possible items with good answers without these disabilities. Please note these exceptions should be written on the MMSE forms. It's important not to allow your administration of the test to be affected by your perception of why the patient may have responded incorrectly or not at all. Here is an example. A blind person can read, close your eyes, write a sentence or copy the two five-sided figure. The items 17, 18, and 19 are omitted. The maximum score of these 3 items is 3 points. If the person's total score is 15, then you have to multiply it to 13 and then divide it to 27. So the calculated score will be 17. Please write this on the MMSE forms. Here's the table for cutoff point abnormal MMSE scores. For anybody, less than 24 score out of 13 should be abnormal. For the person with less than 8th grade of education, 21 should be considered as cutoff points. In any circumstances, consider 3 points drop in the MMSE since the last exam clinically significant. For each item, consider these pitfalls and do it exactly. Score 0 for the following reasons. Incorrect response, if the patient says, I don't know. Unintelligible response in the context of other intelligent response. Participants who attempt to respond but respond incorrectly. For example, they are demonstrating they have heard the question and are making an attempt to respond it. Let's go to the pitfalls. There are a few pitfalls on MMSE. Pitfall number 1. Remember that MMSE does not provide diagnosis for any particular diagnostic entity or dementia. Pitfall number 2. MMSE might be abnormal in many forms of dementia, like vascular dementia or FTD. In this context, their MMSE number could be normal. The content of MMSE is highly variable, lacking significant item to adequately measure visual spatial or construction apraxia. Hence, its utility is detecting impairment caused by focal lesion is uncertain. Pitfall number 3. MMSE is designed for fluent English-speaking patients. Do not translate it into your language. In February 2010, PAR released a second edition of MMSE. 10 foreign language translation: French, Germany, Dutch, Spanish, and 4 US Spanish or Latin American, European Spanish, Hindi, Russian, Italian, and simplified Chinese are also created. You can use them. And also remember that MMSE is a screening tool. A low score indicates the need for further evaluations. And once again, thank you for watching and hope you enjoy it. Bye.